Endoscopic capsulotomy or capsulorrhaphy. Dressings. Tape is to remain on the breasts for 7 days. If tape edges start to come loose, they may be trimmed as needed. We will remove the tape at your 1-week follow-up appointment. You should shower daily and lather the tape with soap and water. Do not soak the incisions in water. The tape can be dried by blotting with a dry towel or by using a hairdryer at a low setting. Do not use the heat setting. Your bra should be washed and dried daily to avoid infection. Sutures. Sutures dissolve in about 2 weeks. Wound care. Tape should be cleaned daily in the shower by lathering with soap and water. The tape can be dried by blotting with a dry towel or by using a hairdryer at a low setting. Do not use the heat setting. After the tape is removed, the incisions are to be cleaned with diluted peroxide and coated with antibiotic ointment or ScarGuard as instructed. Activity. Increased activity is tolerated with no heavy exercise or lifting for at least 2 weeks. Do not lift anything more than 5 pounds the first week. Do not lift anything more than 10 pounds the second week. Do not raise your elbows above your shoulders for 1 week. No bouncing activity for 6 weeks. Example, jogging, horseback riding. Doing these things will help prevent your implants from shifting upward. Avoid driving while still taking prescription pain medication. Special instructions. Continue wearing the bra you are currently wearing unless otherwise instructed. What to expect. Swelling, bruising, and some bloody drainage is normal. As numbness subsides, it is common to feel tingling or sharp sensations. These sensations will eventually go away, however, it may take months to resolve. Signs of hematoma. Painful, extreme swelling and hardness, often accompanied by bruising, usually unilateral, causing asymmetry. Please notify us if you have any symptoms you are concerned with.